I saw 4 dermatologists over the course of 10 plus years, and then I saw Dr. Wells, who saved my life. So I made an appointment to see Dr. Wells for my yearly dermatology visit. And what I've been going to dermatology for every year was the extensive bruising and scarring and wounds on my arms. Started out on my arms, but then eventually was traveled down into my legs as well. My bruising was so bad that I had gone to the wound clinic in June of 2017 prior to coming to see Dr. Wells. I got to where I would only wear long sleeve shirts. You'd think I'd been through a fire. My skin was just terrible. And so then began to scar every time something happened. So I could just touch a pine needle and my skin would break open and bleed. I could bump into a rack at the store and all of a sudden I'd be bleeding. So I had to carry Band-Aids with me everywhere. So yeah, it'd been going on for quite a long time. I started seeing other dermatologists. My first one that I went to was back in 2009. And so they thought it was purpura, skin lesions, and just being out in the sun too much. So basically, photo exposure. But at this point in time, I was in my early 40s, mid 40s. So yes, I did grow up in California, but I didn't quite agree with that, but there was no other explanation. So I went to that particular dermatologist for a couple of years, and then through insurance change, I went to my second dermatologist, and I also went to the first dermatologist for acne, which can be very common in Cushing's disease since I had it on my chin. So she had actually, the first one had given me tetracycline. They no longer made that, so she switched me over to minocycline. So that was once a day. So the second dermatologist said, well, the minocycline is the problem. You need to get off minocycline. That's causing your bruising. So we'll put you on doxycycline and the bruising will clear up. And maybe you should put some arnica on your skin and stop taking fish oil. So that was a consensus from dermatologist number 2. Dermatologist number 3 decided to prescribe me retin A cream to put on my skin over the bruising and thought that perhaps that might help. No other, noticed the photo, just said it was from the sun as well, but no clear explanations. And the retin A cream didn't work. I didn't believe that it would work. So then the next dermatologist, the 4th one, they even noted in the report that I denied, being on cortisone shots or cortisone therapy, which can cause the bruising, but never went past that to dig deeper. And basically said, I could wear bumper pads on my arms, but there's really nothing that could be done. And so I'm like, okay, I didn't really want to live in a bubble. So that, I think, was the year before that I came to Dr. Wells. And so when I came to Dr. Wells with, I showed him the bruising on my arms and my legs, and I mentioned that, my ankles are always swollen, and my blood pressure has been getting a little bit higher. And within 10 minutes, you could see his mind was just ticking, and so he brought up Cushing's. I had never heard of Cushing's. And so I'm like, well, what's that? And he said that he could give me a test for this. And so he ordered a 24-hour urine cortisol test. And sure enough, that came back 10 times the normal limit for Cushing's. And so at that point, you didn't know whether it was in your adrenal glands or your pituitary. But he was the first person to ever mention that.
I remember when Deb came in that she was really frustrated and upset. I think if I remember right, it had been about 10 years that She had been having lots of bruising. She also had high blood pressure. However, she was very active. She was an avid cyclist, and I believe she also did a lot of cycling at home. And she just kind of felt like, despite how active she was, she felt like she was gaining weight. She had seen lots of doctors over the last 10 years and just wasn't able to figure out what was going on. One of the things that happens with people with Cushing's syndrome is that they make too much cortisol. Cortisol is similar to something that we prescribe called prednisone, and there's a certain side effect that happens when people are on prednisone for a long time, and all those side effects are some of the things that she had. I remember asking her if she'd been on prednisone. She hadn't been, and I think slowly the gears started to click and kind of put two and two together. I think that's one of the coolest things about dermatology. I guess I'm a really visual person. It's a very visual specialty, and it's something I think is kind of exciting about it is that you can see different changes in the skin and hear different symptoms people are having, and you can put the puzzle pieces together to try and figure out what may be going on with them.
So when I walked out of the office from seeing Dr. Wells, I felt really excited that a doctor was going to give me another test to see if this, in fact, could be something that was wrong with me. I remember going by my daughter's work, which wasn't that far away, and I said, hey, guess what? I just saw another dermatologist, and they're going to give me this test. And, I immediately looked up what Cushing's syndrome was, and I thought, oh my gosh, I have all these symptoms. And I'm thinking, maybe this is what I have. And I even had written out this list, that I immediately Googled, and I took that to my PCP, in fact, and I said, didn't talk to him, but I gave it to his office gal and said, here, could you please give this to my doctor? And I said, because he doesn't know what's going on either, and, everybody's stumped. And so, yeah, it was really exciting. And so then when he called me to give me the results, I didn't answer the phone. I think it was after hours. And so he gave me his cell number. He's like, call me so I can, talk to you. And so I think, he felt really excited that he had something an answer for me. And so he referred me to endocrinology.
I'm super happy that I think we finally had an answer. She had been searching for a long time.
For this disease, it's rare, but it said that it's not as rare as what it states in books because it doesn't get diagnosed. And the average person sees 10 to 12 doctors, before diagnosis.
It just seems like it's really easy to be really busy. And when someone comes in with a concern, I think it's really important to kind of listen to them and kind of figure out what's going on. I mean, I feel badly that she had been to several physicians that had been doing it for about 10 years without being able to figure it out.
I think the average, is somewhere between 5 to 7 years for diagnosis, although mine was close to 15. So it was a really long time, but it's not uncommon. And unfortunately, we need to advocate, and the patient knows their body. The doctor may have only met them once or twice, or maybe they see them once a year. I think that they need to take the time and not think about what other doctors have already reviewed or maybe labs that they've done, but to take that patient from scratch, like nobody else has ever seen that patient, and do a workup. And I think that's where Dr. Wells, he thought outside of the box. He didn't ask me what all else has been done. He was just thinking about what this could be. And I really, really appreciate Dr. Wells. I mean, for me, he saved my life. They still say that the mortality, if undiagnosed, the median mortality is like 4.5 years, and I just recently was reading that. So it's no different than it was in 1930. So in my presentations that I've done to the residency centers, I haven't mentioned any other doctors except for Dr. Wells, because I don't know if I'd be here today. I had seen PCP, a nurse practitioner, 5 dermatologists, I went outside and saw a couple of other internal medicine doctors. I'd been in and out of the hospital with blood clot, myocardial infarction. I'd been to the wound clinic. I had been going to pain management for 8 years. And it's not uncommon for a patient to see many disciples of medicine before they get diagnosed. So I hope other patients learn not to give up, not only with this disease, but whatever else that you're struggling with, because I know that so many patients are dismissed with this disease, and a lot of it is, there's a lot of symptoms with this disease, and a lot of them are common in the everyday population, such as diabetes, hypertension, obesity, diabetes, those kinds of things. But there's other things that really stick out, such as in this disease, that would make somebody test for this, such as bruising, is very, people that have these other symptoms aren't necessarily going to have the bruising. Proximal weakness, generally what they say is if you're sitting in a chair, you can't stand up without leaning forward or being able to grab the chair. Stretch marks, and to tell doctors that not everybody, I know a lot of patients have been dismissed because their doctor says, I don't have stretch marks. So they're like, there's no way you can have Cushing's. Well, I didn't have one single stretch mark, and I had this for 15 years. It's more oftenly seen in the younger, between 20 and possibly 40. So it's a disease that can't be ruled out, and there's a lot of testing. Just don't give up on a patient. And I would tell patients, keep a log and take photographs into your doctor, because photographs tell the story. Because people will get plethora, which is very common, which is a very filled face, fat in the clavicle pads. But the face will really tell the story in the timeline. I saw 4 dermatologists over the course of 10 plus years. I also had been seeing my PCP on and off for close to 20 years. I saw 2 other internal medicine doctors, a nurse practitioner, hematology, oncology, pain management for 8 years, wound clinic, orthopedics because I had fractures, and I was in and out of the ER and the hospital, inpatient with major problems. And then I came to Dr. Wells November 1st, I believe, 2017. Within 10 minutes, he diagnosed me with Cushing's, thinking that this is what I had and that is what I had. So he saved my life. If you don't feel like your provider is acknowledging your symptoms and what's wrong with you, then it's time to go to the next provider. Because there's an answer out there for you, and you need to search for that. And I'm thankful for Dr. Wells because he was my answer. And yeah, he thought outside of the box, and he came up with something that had stumped all of the other doctors over the years that I had gone to. Yeah. I think that he took me, he had never seen me before, so it was brand new to him. And so looking at me and just with the few simple things that I told him, it just clicked with him. And something clicked with him, and his thoughts were correct.
That's great. Thank you.